Trying to conceive without intuition is like using only half the map. Thank you for joining me today. I'm Lindsay Goodwin, an international licensed fertility, pregnancy, and reproductive medicine expert, trained medical intuitive, and born intuitive medium. I'm here to unfold the other part of that map, the other half, and get you back on track with your fertile vibes. We'll be syncing temps plus tells, labs plus whispers, BBT, charting, cervical mucus, sleep, and mood alongside dreams, clear yes and no pulls, and those repeat ping and spirit baby signals you can actually track. By the end, you'll know how to cross-check intuition with data, spot what truly moves the needle, and choose one calm, powerful next step this cycle. So go ahead and hit play. Welcome to Fertile Frequencies Radio, the podcast that's here to revolutionize your fertility journey by going beyond hormones and cycle tracking. We combine science, spirit, and mindset to help you finally achieve success. If you're done with the same old fertility advice, you've come to the right place. This is where we celebrate every fertile win and empower you to view your fertility as so much more than just your physical body. Get ready for powerful stories, expert insights, and interviews, and endless amounts of encouragement to uplift and inspire you every step of the way. Hello, and welcome back to Fertile Frequencies Radio, and I'm your host, Lindsay Goodwin. For those of you that are tuning in for the first time, and I am your international fertility, pregnancy, and reproductive medicine expert, also trained medical intuitive and born intuitive medium that also had a near-death experience. And after that experience, I began having the duties and mission of being a spirit baby medium as well. Spirit babies started to visit me in a lot of different ways. Dreams were one way, and now I use the integration of my training in holistic reproductive medicine, as well as I am trained in supporting IVF and fertility treatments and understanding about women's health and hormones, men's health, and really being able to get those high success rates. But the integration of how that connects with the unseen, like spirit babies, the unborn souls of our babies coming into our physical reality. And so babies come to me and their parents actually they'll unite with their baby through me as an energetic channel. So I am the best of both worlds. I'm able to really help those that I'm meant to help, including you listening to this podcast. Your baby led you here, and helping you to understand that you are so much more than just your hormones and physical body. So today we are going to be talking about what most of my episodes are about, and that really is the integration of science and spirit in a very grounded, results-driven way so you can plan, and this can become a sequence for you and not a scramble. And really what I'm talking about is medical intuition. This episode is all about medical intuition and really what that is and how that is going to relate to your fertility journey, as well as your overall journey of really learning to listen to your body's cues and signals. And I call it the body is a messenger from the soul, as our bodies are tools to be able to help get us back on track if we are off track. So I'll go into more detail of really what that means, and you're going to walk away with some great information today. But first, I have to state as medical disclaimer that this episode or any information you receive from Fertile Frequencies or my bigger company, Garnet Moon, are all educational in nature. And this is not considered medical advice. I am not your medical provider, especially if you are being treated for any medical condition, as well as if you are going through fertility treatments. Always discuss with your reproductive endocrinologist, your fertility clinic, or if you're someone that's pregnant, please always discuss with your doctors, because we are talking about educational sort of content here. It does not make me your medical provider. This is not what this podcast or any other podcast is actually about. So make sure you're talking with your providers. I hope you have a great relationship with them, that you can ask them as many questions as you need, because that is the way that it should be. Open and transparent. That's my motto. So, what is medical intuition? Medical intuition. Medical intuition is pattern literacy, and it's really across 4 layers that we're going to be talking about. And let's break this down. So we've got physical biology, which is going to be the cycle rhythm, the BBT trend, cervical mucus quality, the sleep depth. Oh my gosh, sleep is so important when you're trying to conceive, as well as your digestion, your microbiome. Big part of this. Skin and hair and pain patterns. And there absolutely could be more, but these are just giving you some important focus here of the physical biology. And then the context here is stress load, trauma history, work schedule, as well as movement and environment and nourishment. Okay, so this would be the second area that we're looking at in these 4 layers. And then we have the third, which is subtle data. Okay, so this is the third layer, which is the gut pulse. This is more of the intuition that we're talking about here. Gut pulse, imagery, dreams, synchronicities, and sudden clarity or eversion. Okay, so if you feel like you don't resonate with something, always pay attention to that. And then we have the fourth layer, which is relational field. Okay, so this is partner dynamics, family pressure, provider rapport. Okay, so important to remember all 4 of these are part of medical intuition, and it really is linking back into your intuition, but also using your body, like I said, as a tool to be able to navigate your experience. So if something is off, your body is going to tell you. And just because a provider might say that, oh, well, it's not showing that on the test, it doesn't necessarily mean that deeper investigation shouldn't be happening. Okay, so this is where things like functional medicine is really powerful, because that's getting a much deeper layer into something that could be going on with your actual physical biology. So I always want you to trust your intuition, no matter what sort of therapies you are receiving in your fertility path. Okay, whether you are receiving IVF, IUI, some sort of hormonal therapy, or you're pregnant, or you're trying to conceive naturally, please trust your intuition. And if you really feel that something is not quite right and your provider is not listening to you, I would suggest getting a second opinion, looking at another option, because your intuition, your discernment is going to be the strongest way to be able to know if something is going on, because doctors miss things all the time. We're all human, right? It doesn't make your doctor bad. It just could be that maybe they just don't see it like you do. Maybe they're not well versed in a certain area, and you need someone that's more detailed in an area that they don't understand. And it is about integrative medicine also. So if you are working with a reproductive endocrinologist and you also choose to work with someone like myself or a functional medicine specialist, that it's about integration. It's about being in a environment with providers that want to integrate. This is really powerful. They want to work together with the interest. Their interest in mind is getting success for you and supporting you in that process. So I can't drive that home enough. It's very important for your providers to want to work together in helping you, and to not be trying to shut things down because they might not particularly understand some provider that you're working with. So we should be open and accepting if it's something that you feel good about. You feel good about it because you're trusting your intuition. So this really isn't about by any means replacing diagnostics when we're talking about medical intuition. We're using this as a tool. Okay, diagnostics is something totally different. That's science. Medical intuition, some of it can be translated into science, but it's really not science. It's more of intuition. It's more of the unseen energies. It's more of the knowing. And as a clairvoyant, I have the ability to be able to see as well. And there are many people that do see uh, psychically with their third eye. And when I'm doing a medical intuitive reading, I can actually see as well as hear and receive thought forms of where there is disharmony in the body. And also, as a licensed health provider that specializes in reproductive medicine and pregnancy, I also am able to understand the way that I'm receiving messages from the unseen or universe, whatever you want to call it, through my psychic senses, that I understand it on a science level as well. So it's deep, and that I could see something and then be able to translate it in a way that you could go and take that to your doctor and say, okay, look, we need to test my progesterone, or we need to look at my uterus. Is there any uh is there some fibroids or cyst? It could be I might pick up on something that your tubes are blocked. There could be a lot of things, endocrine system, hormones being off. I mean, the list goes on, and that makes it really unique. And that I am able to understand the science side of what's really going on. So I'm not a fan of the woo woo, because I am all about the integration of science with the unseen. And quantum physics is proving so much of what we used to think was woo woo. So I almost think that when people use the word woo or woo woo, it's almost an insult to these incredible intuitive energies, because it's not far fetched. This isn't a weird sort of thing. And that's where woo and woo woo came from, is that it was somehow so off the spectrum that most people wouldn't get it. But I'm on a mission to help people understand the both sides of the spectrum, and that we really can integrate a lot of these unseen sort of energies that quantum physics is now proving that are not so woo anymore, as data, that it's not far-fetched. So I'm not a fan of that. I'm very evidence-based as well as an intuitive medium, and so much of this is, to me, I think it's a lot of it's pretty practical. I don't really think it's woo at all. But I won't digress too much on that. I just wanted to state that we're not replacing diagnostics with medical intuition, okay? So medical intuition might, like I said, pick up on something that needs to be investigated on. That Western medicine, biomedicine, modern medicine can actually say, okay, look, let's investigate that. You as the patient could say, client could say, I need to look at this. Let's investigate this further. And a good provider will say, yeah, you're right. You know what? I respect that. Let's investigate that. And that's what I want you to look for in your providers, is that they support you and that you feel that you need something and they're like, okay, I'm on board with that. Let's investigate that. Not putting up this boundary and this wall that you can't advocate for your own health and your own fertility journey, because it's your journey and you've hired them. I mean, that's something that we got to think about. You hired them. Why are they trying to tell you what to do with your life? I get it that we got to trust our providers, but also don't take advantage of that. Don't try to make it so that you're putting out the message to your patients that they can't ask for things that they feel intuitively that they're aligned with. We have to trust our patients that they have trust in us, and that they feel something, and let's investigate that. So I don't want to digress too much on that, but I want you to always understand and know that. I want you to embody that you've hired these providers. They need to link up with you and also let you advocate for your own health and your own fertility journey. So the ethics and boundaries of this is read your own field or with consent, and you want to validate these impressions against measurable change. and look for convergence across layers, not just one-off hunches. So what that essentially means is that you get an intuitive feeling about something, and then you take it, like I said, to your doctor, and you get a test. Okay. You get more investigation. Or if your doctor can't do the deeper investigation, like with functional medicine, if that's out of their scope, then you go to somebody that can help you with deeper layers. Okay. So this is really what medical intuition is about. It's all about trust. And why is this so helpful when you are TTC trying to conceive? Because conception thrives on timing plus safety, and medical intuition helps you catch trends early, like luteal spotting at 3 a.m., wake ups, or anytime, blood sugar, cortisol conversions, also noticing sequences like nervous system safety, ovulation quality, luteal stability, and implantation support. You can also choose modalities that fit, like acupuncture, somatic work, nutritional tweaks, lifestyle changes, and what is guided by your body that seems to be a clear yes or a yes or leaning towards a yes. Sometimes we don't have very, very, very strong yeses. But if you feel that you're leaning more towards a yes, then that's a yes. Okay. Also, land timing. So, subtle pelvic warmth, brighter mood, and peak cervical mucus often precede OPK by a day. So, your intuitive timing could be ahead of those ovulation testing kits. That's why I always tell my clients, when having intercourse around your ovulation window and not always relying on the ovulation testing kits, because you could be off a little bit and that egg is really going to only be at its best top quality for 12 to 24 hours of after being released. And so that's the peak window. That's really when you want to hit it, because that's when the egg is going to be as healthiest. And we do know through miscarriage that a lot of times, I can't say every time, it can be the sperm quality as well, that there's chromosomal things going on. And this could absolutely be because the egg wasn't of great quality. And this is a huge part of this. So remembering that when you are having intercourse for pregnancy, conception, not pregnancy, but getting pregnant for conception, that it's important to have sex 2 days before that window and 2 days after. And of course, on the day that you think you're ovulating, because this gives you a bigger window and finding a way to enjoy it versus feeling like it's just about making a baby. And that's something I help my clients with is couples connection, as well as working through some of those communication barriers, as well as the pressure around intimacy and having a baby and expanding your family. So, also, we want to reduce treatment fatigue and focus on steps that measurably shift sleep temps, cervical mucus, and mood. So, this all is really helpful when we're thinking about medical intuition, trusting our intuition and our body signals when we are trying to conceive. We also have cycle intelligence and how each phase is interpreting. I guess I should say what each phase is interpreting to you. Your cycle is like a monthly dashboard. Menstruation usually is between 1 and 5 days with bright red, moderate flow, mild cramps, and it's a clearing with ease. Okay. So, not a ton of cramps, mild cramps. It's actually not normal to have crazy intense cramps or a lot of blood clots and dark blood, because that can be a sign of a cold womb. Dark purple clots and strong cramps, it could be considered circulation plus inflammation. It could actually be considered something of estrogen dominance as well if you have a lot of cramps. So there could be, or dark blood, it could be that there's a diet modification that needs to happen as well as mind-body connection and stress management support, regulating the central nervous system because our periods are directly impacted, as well as hormones are directly impacted with how our central nervous system is functioning and our brain is communicating with our hormonal system. And so that's one thing with women, and men have cues too, signals as well. But with women is that we can really tell what's going on with our emotions and our hormones based on what's our cycle like. Do we have a lot of cramps? Do we have a lot of PMS? Is our period flowing? Is there a lot of dark blood? And you might be in a beautiful relationship. I hope that you are, and might still have some of this, and it could be stress in other areas. So it doesn't necessarily have to be relating to your relationship with your partner, but it could be maybe it's a relationship with a family member that's really stressing you out, or maybe it is some sort of trauma that you're holding in your womb, and that is actually shutting down your body's ability to want to conceive. So that would be what's called a cold womb, and in Chinese medicine, we call it the Bao Lao, and that is the connection with the heart and the womb space. And I've done episodes on that here at Fertile Frequencies, and you can go back and listen to those if you are interested in learning more about that. So, also very light, short bleed. And this also could be relating to diet as well and hormones because there might not be enough lining from nourishment of the right kind of foods, as well as thyroid dysfunction. There could be issues with thyroid or iron, and you absolutely want to discuss this with your licensed medical provider or provider that is licensed because you don't want to be taking too much iron. You also, if you're taking medications, blood thinners, you want to be really careful with iron. So make sure you discuss that with your provider. And then we've got the follicular phase, which is that post bleed. So that usually starts on day 3, actually, when you are still bleeding, which is interesting. And that will move into ovulation. So this is really when the energy is rising. You're getting more creative energy. Your estrogen is building and you might get some brain fog or low drive, which this is an emphasis on you need more protein, minerals, and sleep. During the follicular phase, you really should have a lot more energy. That's more of a healthy sign, as well as you tend to get a little more like flirty, a little more interested in being flirty, as well as intimacy. So your body's starting to prepare for ovulation. And you could have some scanty kind of cervical mucus, which you do want to make sure there's different herbs and things that you can take for that. Again, work with somebody that's a licensed health provider that can help you with that, or functional medicine, or certified, board certified herbalist, Chinese medicine doctor, somebody that can help you, or a nutritionist as well, a licensed nutritionist that can help you with herbs. Um, and you want to make sure that you are hydrating well, as well as essential fats and stress downshifting, which can help with the estrogen FSH if we're having issues with those being overabundant and too much. We can definitely look at things like stress and really how to downshift that. And I'll do more episodes on that. I talk an awful lot about stress on this podcast. So if you want to learn more about that, you can refer to other episodes or make sure you follow this podcast because you'll get all kinds of information on stress and many other topics like what we're talking about that are incredibly powerful, that will not only help you have success in your fertility journey, but through your pregnancy as well. So we've got the ovulation window where we're getting egg white cervical mucus. You might have mid-cycle libido, so you might have an increased libido. I hope you do during ovulation. If you're not, that might be something to discuss because there could be some issues going on there. You might have, if you're not experiencing a increased libido, that could be a hormonal issue. We also have possibly one-sided twinge, which could be fertile signs that you are on track. And there might not be no clear cervical mucus or temp shift, which that's probably something that we would want to discuss if you were working with me, and we would absolutely be working on that, digging in deeper to look at your hormones. If you're working with someone else, you want to make sure that if you're not having good cervical mucus, you're not really noticing that temperature shift, you could actually not be ovulating. So it's important to pay attention to these signs, listening to your body, not being obsessive over it. I definitely don't want to send that message because that just creates more hormonal imbalance, because then you're obsessing over something and your body knows that you're doing that. So it's going to shut down its fertility even more. So we want to be aware of things, but we also want to remember that our bodies also go through cycles. So if you have kind of a wonky cycle, it's okay. But if it's something that's continually happening, we probably want to investigate that. So we've got the luteal phase, which is post ovulation, and that's going to be right before the phase, either when your body is implanting the embryo or you are going to prepare for your period. So we can see things like stable mood and sleep. Also, warmer temperatures, as the progesterone might be elevating if you are pregnant. And when you are BBT charting, you will actually notice on your chart that your temperature will never go down if you're pregnant. It will, maybe it could dip a little bit, but it's going to continue to kind of stabilize at a higher rate because the progesterone is continuing to stay up, and you're not going to get that that um that quick dip down when the estrogen takes over, when you're going to start bleeding. So progesterone, I call it the pregnancy hormone. It is one of the pregnancy hormones, and it does help with the placenta. So the placenta is one of the first phases of the pregnancy. Well, actually, the corpus luteum, which is where the egg comes out of in the body, is that's what the placenta is. That's how it forms, is from the corpus luteum. So that's surging the progesterone, and that's why you see that progesterone never going down. So a lot of my clients will actually know, and women will actually know, that they're pregnant before they even get a positive pregnancy test if they're pretty diligent in their BBT temperature charting, because they see that the temperature never goes down, and they don't start bleeding, or they might start spotting, because spotting in pregnancy is normal, especially in the very beginning. But again, disclaimer here. If you are pregnant and you're noticing a ton of cramps and there's bleeding, you should always consult with your doctor. In fact, I'm going to say if you're noticing any spotting, you should always talk to your doctor or a licensed professional person, that provider that can help you to understand. But I do recommend talking with a medical doctor about that, just in case if you are early pregnant or you're further along in your pregnancy. Make sure that you're discussing that with your doctor. We can also notice things in the luteal phase like irritability, night sweats, spotting, as we explore progesterone sufficiency, thyroid, and stress load. So that could be, if you have a short luteal phase, that would be something we would see: spotting, irritability, night sweats. We would want to look at things a little bit deeper of where your progesterone is in that luteal phase. And a lot of women do have short luteal phases, and they do have things like thyroid issues, as well as other things, mood swings, things going on, and spotting. Spotting's a really, really big one. And we've got cravings plus that 3 a.m. wake up. That could be things like blood sugar and cortisol cues. Okay, so these are all body cues giving you about your cycle. So here's some labs 101 that we might want to ask our provider, and why, as you ask your provider which ones are right for you now and what optimal preconception supportive ranges look like. Okay, again, I'm not your medical provider, okay? This is just educational information. So definitely discuss this with your licensed qualified medical provider about how to interpret some of this stuff and if this is right for you. So let's go ahead and jump in. So we've got the ovarian hormone rhythm. So we've got AMH. This could be the day 3 labs of the FSH, LH, And the E2 estrogen, we've got mid-luteal progesterone and prolactin, okay? So that is something I would be asking your doctor for if you are starting on your fertility journey or if you've not had those tested in a while. It is important to look at that. We've got the thyroid, so we've got hormones, the TSH, the free T4, the free T3 antibodies are important to check all of that relating to the thyroid, especially if you're having things like mid-cycle spotting. You want to get that checked out. Maybe spotting or short luteal phase. You definitely get your thyroid checked. We've got metabolic inflammation. So things like if you suspect you might have PCOS, we've got fasting glucose, fasting insulin, A1C, and lipid panel. Important to check all of that. We've got the nutrients. Okay. So we talked a little bit about the ferritin and the iron panel. Also important to check B12. And I'm going to say this. I've done episodes on this, but folic acid, not good for you. Do not take folic acid. Okay. Folate is the natural form of the B vitamin that you need to prevent spina bifida. Okay. Do not take folic acid. It's synthetic. Not all supplements are created equal. Make sure you're doing your research or you're working with someone like myself. If you are in one of my programs or you're interested in one of my programs working one-on-one together, make sure that you're talking with your providers, because in all my programs, I will not let my clients take folic acid. It's very serious. Make sure you're taking folate. Folic acid is toxic. And I can do more episodes on that, but outside of just fertility, it's not good for you. Make sure that you're taking vitamin D, and I'm going to add K2 in there too. So you want to take a vitamin D with K2. K2 helps the vitamin D absorption. So a lot of supplements now are a mix of vitamin D with K2. Again, talk with your doctor about all these supplements. Do not just start taking things without asking them, especially if you're receiving medical treatments. Very important to make sure that you are in communication with your providers, and because they know what's going on, they know how to help you. Also, the stress context, case by case, things like morning cortisol or clinical rhythm assessment. So morning cortisol is really important, but it's actually important to do midday and evening cortisol as well. So you want to work with a functional medicine doctor that can help you with that and doing those testing. A lot of medical doctors, like general medical doctors, they'll do like the morning cortisol, but they're not testing the afternoon and the evening cortisol as well. And it just isn't sufficient. So make sure that you're working with the right people that really can give you the deep investigation that you're looking for. If you are someone that has been trying to conceive for a while, or you are just starting out and you want to make sure that you're hitting all the areas and that you are preventing things like miscarriage, and not every miscarriage can be prevented. So I'm definitely not sending that message, but some of them might be able to be prevented. And if you did have a miscarriage, there's nothing that you did wrong. We are always evolving and growing in this experience, and sometimes things happen to help us grow. And so it is not a judgment or that you did anything wrong or could have prevented it because you just didn't have that information at the time. But for someone that's just starting out and hearing this information, this might be different for you. So here you go. We've also got the androgen testing. Okay. So this would be things like the DHEA S, as well as the total free testosterone. These are really important to know. Testosterone, so many women are either deficient in it, men as well, which can have a huge impact on sperm as well as egg. And there are women that are over testosterone abundant as well. They have too much of it. And that's usually we see things like PCOS has too much testosterone, and that will cause issues with being able to ovulate. And because it's not natural for women to have too much testosterone. So there are so much medical, holistic treatments out there to help with these things. So make sure, again, that you're working with a licensed health provider that can really help you with this. I just had to state this. We are in a world now where there are so many people online. There are wonderful fertility coaches, but I have seen a lot of information that is not accurate, and they are not licensed health providers. And this might ruffle some feathers of people listening to this, but it needs to be said, and because I'm all about education and I'm not here to sugarcoat things. And I have seen a lot of information that is not accurate. And with the internet now, anyone can say anything they want to. They can create content, they can create blogs, they can write books, they can do all kinds of stuff that's not fact checked. I am all about facts as well as the integration of the unseen energies with the energy. I am not against IVF. I am not against science. I am all about integration of that. And I also see a lot of providers on the holistic side that don't want to integrate the um the science side of fertility treatments and pregnancy support. I'm not a fan of that. Um, we are in a place in our evolution that it's about integration. It's about coming together as a community and supporting each other. So one side is not better than the other. It's that we need to come together and treating people like you as a patient or a client, but also as a community, as a human collective. And stop thinking that we're somehow separate from each other and that we have these egos that one is better than the other. But I will say, educating you that there are a lot of people that don't know what they're talking about. So if you are seeing a fertility coach that is giving you all kinds of advice on supplements, on testing, and they don't have any certification to do that, they're out of their scope of practice. They're not supposed to be doing it because you are only supposed to be doing that if you are a licensed health provider. Um, and that's an actual certification through the state or states. It is not a coaching certification. So be very careful with that. I have had clients that have gotten really sick as well as had very abnormal labs come back because they were working with people that were working out of their scope of practice, trying to prescribe things or do things that they're not supposed to be doing. So please, please, please choose your providers wisely. Do your research. If you have any questions, please feel free to reach out to me. I'm always happy to help. And when you work with me, I absolutely will make sure that you are getting the correct information. Because I am a licensed health provider as well as a certified fertility coach. Not a huge fan of the word coach for myself. I prefer fertility mentor. Um, but you are absolutely going to get the care that you need from someone who actually does know what they are talking about and has been in the industry for a long time and seen hundreds of clients and patients, and pretty much has seen everything under the sun as far as some of the most difficult cases of people that didn't have success anywhere else. So just trust your gut. That's what this whole episode is about. Trusting your intuition, using your body, medical intuition as a way to be able to trust. Okay. So I want you to think about this for a second. I want you to think about spirit baby communication. Okay. Because that's what we are going to move into next. Is because spirit babies are part of this medical intuition because they communicate through your body. And I hear this so much when I am doing spirit baby readings that spirit babies will come through and they will talk about different foods for you to eat, um, different health issues that you have going on. Oh, my mom's not sleeping well. Or she gets really stressed out about family trauma. Or my mom needs more protein. So they come through to deliver messages of how to get your body and energy in a place that they can actually come into your experience. Remembering your body's a portal. It's a portal for them to be able to come into the physical world. Okay. So here are some ways that they're communicating with you. We've got some channels. We've got dreams. Okay. So there could be a lot of things. It could be that um, in a dream, your baby's handing you some sort of object or food. And it could be some sort of therapeutic message about, like I said, something that you need. Or maybe around ovulation, you are around water. Or I have this a lot where my clients will dream of water a few months before they get pregnant, or when they're pregnant and they don't know it yet. That's usually an indication for me that someone is pregnant or will be soon. And also, I mean, this sounds really just kind of interesting, but at the same time, like, kind of obvious, like, simple. You might be on a train and doors might be opening on the train. And this might be around a transfer, like timing the transfer. And why is that? Because when you're on a train and the doors are opening, you're going from different stops. So it's like you're transferring. I know this is the thing. I decode dreams and sometimes these seem really weird, but to me, now that I've been doing it for so many years, it actually is just pretty simple. But we as humans, we want to try to make it very detailed, but spirit is actually saying, no, this is actually very simple. And spirit is your spirit baby, which are unborn souls, essentially, that want to come into the physical reality and they choose their parents. They choose you. So there's other things like synchronicity. You could see repeating names, numbers, animal messages, coinciding with maybe fertile days. You might have body sensations, sudden lower body warmth when viewing a clinic or time or provider. You might have goosebumps when you state a boundary or when something feels aligned. You could have inner phrases, like simple words like during meditation that you just hear things. I do all the time, like rest, now, be kind. I hear a lot when I'm doing readings, I will hear spirit say resistance. And I know what spirit is saying, that you've got to help that person to be able to release the block, the resistance, to let down their walls, to let the abundance in, to let their physical body receive, but remembering that your energy is what's receiving. It's having your energy, your radio station tuned to the right signal. That's how your frequency is. Is it just tuning to the right signal? And that's what bringing your pregnancy, your baby into your body, your portal is just you're tuning to the right signal for that to manifest. Okay. And it's not that you're doing anything wrong. And sometimes things need to happen first before that signal gets tuned to actually bring in that clear signal, which would be the baby. And that sometimes can take time. And it's giving yourself grace and remembering that we can't compare ourselves to other people because everyone's journey is different. Okay? If you're listening to this, you most likely are someone that has come here to have a very deep human experience. And your fertility journey is part of that. It's an awakening, it's a self discovery journey. And while you're having it, you're in it, it's so painful and it sucks. But I will tell you, I've seen this time and time again, that coming out on the other side of it, that you realize that I wouldn't be who I am today if I wouldn't have experienced that. And I'm going to say it. We actually will be grateful for that transformation. And this is the best way that I can describe it in my own experience. When I was robbed in 2017 at gunpoint and I had an out-of-body experience, as well as I had a criminal stalking case that I was involved in. Both of these situations were very traumatic. And did I think at the time that I was grateful for them? No. I did not. I was very upset. It was painful. I didn't understand why it was happening. But through the healing process, now on the other side of it, I'm grateful for both. Because I wouldn't be able to talk with you how I talk with you if I hadn't experienced those experiences. I know what it's like to be in a place of pain. I know what it's like to be in a place of that you feel like you're losing your mind. No one understands you. No one's listening. You feel that the world is attacking you. You feel a void. All you want is peace. All you want is your baby here. All you want is for it to manifest. You feel like everything that you're doing, you're eating the right diet, you're going to therapy, you're working with a fertility energy healer, you're in the programs, you're taking the supplements, you might be doing IVF, you might have done several IVF cycles. You might be considering egg donation or adoption. Maybe you're even doing this on your own. And it can become very lonely because you feel as though the universe hates you or God doesn't appreciate you. But it's not true. It's because the transformation is what we come here for. We come here to evolve and to remember who we are as these powerful creators. And I just want you to sit with that. I just want you to sit with that. And I want you to think about that comparing yourself to others that aren't here for the same purpose. It's a battle that you'll never win. You'll never be satisfied in your life if you compare yourself to other people. I don't care what it is. I have a lot of different clients, and many of them are fertility based, but some of them are not. I'm an energy alchemist. I am a holistic medical provider. I'm an intuitive medium. I'm a thought leader, a speaker of truth. I'm a lot of things. So I attract a lot of different kinds of people, and I will tell you that I've had clients that I've helped them through their fertility journeys, and then they continue to work with me on other things after. And the same things will come up. Because your journey is all connected, and it's not always about just the fertility. This is my point. It's about patterns. And that's what your fertility journey is helping you wake up to. And some of us are more stubborn than others. I can raise my hand there. That's why I've had so many spiritual awakenings, because I know my purpose, and the universe has known a long time. I mean, forever. But I wasn't. I was living too much in the trauma and wasn't fully awake. And so I had to have things happen that were painful for me to realize what I truly am and what I'm here for. And that's to help you. But I had to help myself first. And this leads me all into that it's not only about you, but it's being in the best version of yourself as a parent. And these babies coming in now, these souls, they're looking for their parents to have done the trauma work. And no, not everyone's doing that. Again, I'm going to state, we can't compare our lives to other people. If you're listening to this podcast, you're one of the ones that's doing the deeper work, or else you wouldn't be attracted to me. And how do I know that? Because I just do. Because I know who I attract. So if you're listening to this, you and I have a lot in common. I know you. I know what you're here for. And so does your baby. Anyway, I digressed a little bit. We got a little poetic there, but I love that. I'm here to empower you. So listen, beautiful, I am just so excited that you joined me today. And this is the end of the episode. And I want to remind you that if this episode served you, please share it and leave a quick review. It helps women who are calling this in find it more easily. And also, make sure to grab your free fertility guide that is all linked in the show notes. This is really going to help you with some of those intuitive cues, as well as some different ideas on diet and supplements. And there's some other good things in there. It's 7 powerful steps to boost your fertility. So make sure that you get that in the show notes. And I'm Lindsay Goodwin. Your data has voice. Your body does too. And when they sing together, timing gets clear. And I'll see you next time. Now, before you close the app, quick gut check. What's the one calm, powerful steps you're taking this cycle? If this episode gave you clarity, tap follow, drop us a 5-star review, and share this with your friend who needs less guesswork and more guidance. We can't keep this show going without your support. Your support helps this message reach the women and couples who truly need this message and are calling it or praying for it now. And as a teaser alert, episode 28 brings a special guest, a doctor of Chinese medicine, holistic fertility expert, and founder of Health University. We're going deep on the evidence meets energy for smarter timing and smoother cycles. You won't want to miss it. And I'm Lindsay Goodwin, medical intuitive and reproductive medicine expert. Keep tuning your signals, keep tracking your wins, and meet me in the next episode.